I'm Matt Willis, Public Health Officer for Marin County with an update for February 3rd. Today, I'd like to share a bright spot, a new tool to tackle one of the most challenging and painful areas of our pandemic experience. For the past 2 weeks, COVID-sniffing dogs have been working to control outbreaks in our long-term care facilities. This pilot project is a partnership between Marin County Public Health, the California Department of Public Health, and a nonprofit called Canine Companions who trained the dogs. The results are really promising, and I'd like to describe why we took this step, how it works, and what we're learning. The majority of COVID deaths in Marin have been among residents of long-term care facilities who were infected during outbreaks. And that's for 2 reasons. First, it's very hard to control spread of the virus among people living together 24/7 under one roof. And 2, older and more vulnerable people are more likely to have bad outcomes when they're infected. So we've been really eager for solutions. One of the most important elements of outbreak control, whether it's a school or a nursing home, is early detection of cases to cut off chains of transmission before they start. At the same time, full-scale testing of all students in a school or residents of a long-term care facility, even with rapid antigen testing, is really challenging. It can be disruptive to the environment, can take all day, is costly, and generates a lot of waste. So there's our challenge. How do we screen large numbers of people in a short period of time, feasibly and accurately, to detect infections before they spread? And the answer might be dogs. In less than an hour, trained dogs can scan hundreds of people to identify COVID infections just by sniffing around their shoes and ankles. The dogs can detect what are called volatile organic compounds, or VOCs, which are released in human breath or sweat when someone is positive for COVID. Dogs have hundreds of millions more specialized odor-detecting neurons than humans. They can essentially see with their noses. That's why dogs are used to sniff bombs or drugs or find people buried under rubble in earthquakes. It's a matter of training dogs to use their innate ability to detect things we cannot see or smell. So here's how it works at a facility. It's pretty simple. An escort, someone on the staff who knows the residents, pairs up with a handler who leads the dogs on a leash. Together, they move from room to residents who have consented. The dog briefly sniffs, usually at the foot of the bed, and signals infection by sitting. We then follow up with a rapid antigen test. With funding from the CDC Foundation, the state of California has invested in training 2 dogs, labs, named Scarlet and Rizzo. In the laboratory, they learned to identify SOCs from COVID patients with 95% accuracy. In fact, as a sidebar, some of our residents might remember being asked last year by our team to share your SOCs just after you were diagnosed with COVID to help train the dogs. So if you're one of those people, thank you. Your SOCs were put to good use. The first goal of the pilot was to determine the feasibility and acceptability to staff and residents of facilities. And the basic feedback is that the dogs actually enhance the environment and help people feel more relaxed. The dogs are labs, the same kind used as guide dogs for visually impaired people, and are gentle and well-behaved. Regarding accuracy, the dogs perform similarly to rapid antigen testing, but we know they can do actually better than rapid antigen tests in the laboratory and might improve once they become more familiar with the facility setting. We'll have more complete results of this effort at the end of January. If this works, it's possible to imagine a future where dogs become part of a local public health team, traveling between facilities, schools, and other settings, screening everyone to identify infection before it becomes an outbreak. We also know that dogs could potentially be trained to detect other infections, like flu or norovirus, because these infections also have their own specific compounds that dogs can be trained to detect, the way they detect different kinds of explosives, for example, at an airport. At this point in our pandemic response, we see this as the time to be refining what we've learned and to shore up our systems so we're better prepared for the next pandemic. Outbreaks in long-term care is a weakness that needs to be addressed nationally. As far as we know, this is the first time dogs have been used in these settings nationally, and the results are promising. We're fortunate to have the partnerships and the will at the local and state level to not only follow, but to help create the evidence base. and to advance the science. 2 years ago, we piloted something that may have sounded a little odd, of using sewage to measure virus levels with UC Berkeley. Now wastewater is one of our most reliable and valuable tools for tracking a number of viruses. So maybe 2 years from now, we'll look back at this pilot project in the same way, and we'll thank Scarlett and Rizzo for doing their part.